And active design really is about the key roles of city design infrastructure, including transportation infrastructure, in addressing health issues. So this slide demonstrates basically some of the successes and challenges of public health in the last century and in the current century. So in the 19th century, infectious diseases, that are due to infectious agents were the primary causes of death. And we basically utilized our city's codes, planning, and infrastructure as weapons to battle these diseases. We built them into the city fabric, these strategies, and they were really effective. In the 21st century, we've got a different set of diseases, chronic diseases, many of which we can actually think of as diseases of energy. So conditions like obesity, diabetes, heart disease, and strokes, they are very much influenced by the diets that we eat. So calories, of course, are a form of energy, and by the calories that we actually expend in daily life in the form of physical activity and active living. And because of this link to the energy equation, many of the design solutions to address, prevent, and control chronic diseases actually parallel sustainable design solutions in our communities. So we'll see some slides and talk about that as well. And in order to be effective, we have to start to make these designs and infrastructure interventions a part of our daily life. So going back in history, this is a slide of New York over 100 years ago, but this is actually very reflective of many of the urban conditions and how many of our cities began. Urban conditions in the 19th century and early 20th centuries very much were a breeding ground for the types of diseases that we saw that were very prevalent and epidemic at that time. So for Lower Manhattan, at the time, we had very severe overcrowding. 1910, the densities were 114,000 people per square mile. That's approximately double what it is today. In some of the wards, it actually reached over 400,000 people per square mile. That's 6 to 7 times what it is today. And combined with that, you had inadequate systems for garbage, for sewer, for water, leading to polluted water supplies and pervasive filth. If you read some of the history books, you'll see New York's water supply described as a pond downtown that frequently had dead animals and garbage floating in it. So it's no surprise that the types of epidemics that you saw at the time were diseases that were spread by overcrowding, like tuberculosis, waterborne diseases like cholera, mosquito-borne diseases like yellow fever, because the streets were also very dark and dank and would breed these mosquitoes. And the response that we undertook in the 1800s and into the early 1900s was very much an infrastructure response. So after multiple cholera epidemics in 1842, New York City new water supply, the Croton Aqueduct in upstate New York, was a new reservoir, and with that establishment, the cholera epidemics went away and they never came back. 1857, Central Park was created, hailed as ventilation for the working man's lungs. So now people had a place to go where they could get fresh air and get out of their tenement buildings, out of their buildings, which at the time had no windows in some cases. 1881, Department of Sanitation was created to clean the streets of dead animals that would just be left there to rot, of garbage, of horse manure that prior to that would just pile up on the streets with no one removing them. In 1901, the Tenement House Act was passed, and now all buildings, including housing tenements and stuff, had to have windows. And so now you got rid of dark, airless tenement buildings, and light and air could enter through the windows. 1904, first section of the subway opens, and in very large part, the subway was created in New York City to address that severe overcrowding in Lower Manhattan. Now, all of a sudden, people could live in northern Manhattan and the Bronx, and yet travel quickly down into Lower Manhattan for commerce and for work. 1916, a zoning ordinance was passed that required buildings now to set back from the streets somewhat, so that light and air now entered those streets, and you dried up those puddles, those mosquitoes went away, and all of a sudden yellow fever also disappeared. So these are the results that we see. In 1880, leading causes of death in New York City and in many of our cities when they began were infectious diseases. By 1940, those deaths had dropped to 11% of deaths. You could see that between 1940 and 2011, they dropped some more, but not by very much, actually, from about 11% to 9% of deaths. So the huge gains that we made between 1880 and 1940 were actually fundamentally not due to the medical technologies and treatments that are available today. Most of our medical technologies, including antibiotics, occurred after 1940. So 1940 was before the widespread use of antibiotics. Penicillin was just discovered in 1939, was not in widespread use in 1940, and most or all of the other antibiotics were not yet available. And so this is to say that how we design and build our built environments are actually key in the types of disease epidemics that we're going to see. Treatments play a role in treating diseases once they've occurred, but prevention through a healthy city and the infrastructure that we place in it are actually vital to the health of our populations. So the epidemics of today, a different set of diseases, chronic diseases, obesity, diabetes, heart disease and strokes, cancers. According to the World Health Organization, they are now the #1 cause of death globally, at, causing 36 million deaths a year. Even in the developing world, heart disease and strokes have overtaken infectious diseases as the leading cause of death. The leading risk factors accounting for 80% of these deaths, according to the WHO, are tobacco, physical inactivity, unhealthy diets, harmful use of alcohol. The two items in red, physical inactivity and unhealthy diets, as I mentioned early on, they are also linked to this energy equation in the form of energy in, too much energy in unhealthy foods and beverages, too little energy out in the form of daily physical activity. These slides that I'm about to show you are maps created from data that the U.S. Centers for Disease Control and Prevention started collecting in the mid-1980s. So there's a survey done every year of the U.S. population, and now it's across all states, that asks questions about people's health, people's behaviors and risk factors. And then a couple of the questions actually involve asking people about their heights and weights. The heights and weights are then used to calculate body mass index, and a body mass index of 30 or above is considered obese. You could see that in 1985 when we began data collection in the U.S. There was not a single state above 14% in terms of rates of adult obesity. You're going to see this change very quickly. By 1991, you've got a new color above 15%, 15 to 19%. By 1997, the majority of the country at above 15%, some above 20%, but it doesn't stop there. By 2001, the majority above 20%. That light blue color, that's only Colorado, that's left behind at less than 14. 25% plus is another new color. And again, it doesn't stop there. By 2005, new color of above 30%. 2009, vast majority of states above 25%, 30% plus in many states. And this is not a phenomenon that is unique to the United States. All developed countries are facing this issue, and so it's critical for us to address. Diabetes trends, type 2 diabetes, very much tracks these issues, and so we've seen huge increases in diabetes rates as well. And huge costs associated with this. About $150 billion a year are spent in the U.S. on medical costs related to obesity and obesity-related conditions. By 2030, if the trends continue, projections are that the costs would reach nearly $1 trillion each year. To address medical conditions related to obesity. And this is just medical costs and healthcare costs, so we're not even taking into account productivity costs, costs like sickness absence for workplaces, etc. Now, you've often heard the debates about genetics versus the environment. Is it our genetics or is it the environment that we have to address if we're going to address these diseases? Well, you've seen how quickly obesity and diabetes have increased, and our genetics certainly have not been changing over, you know, 2 to 3 decades. So certainly, but if you look around you, our built environment certainly has. Many of our communities now are not walkable, they're not bikeable. Children used to walk to schools, and now many of them don't. We, in our buildings, rely tremendously on devices like escalators and elevators, even for going 1 or 2 or 3 stories. You could see there that people are walking up a very small flight, are standing on a very small flight of escalators rather than walking up the stair to get to their fitness room. And similarly, unhealthy, highly caloric, non-nutrient foods are available everywhere. So, you know, it used to be that newsstands only sold newspapers and magazines, and now increasingly in the United States, newsstands sell junk foods, they sell soda pop, and so we're inundated basically with unhealthy foods and beverages. At the same time that all of this is happening, we've had, you know, a great body of research that has also been undertaken, particularly over the last decade to 2, that is showing us that, in fact, it doesn't have to be this way. That there is, in fact, scientific evidence now from our studies to show that we can design to increase activity in daily life through transportation. So building walkable neighborhoods that have a sufficient density, that have good sidewalks and bike paths, that address street safety from both a traffic and crime perspective, having mixed land uses, all of these things can increase physical activity 35 to 160%. We can also design to increase active recreation. So having access to places for active play for both adults and children near work sites and near homes is actually a critical factor in increasing leisure time physical activity, and is also associated with better weights. Designing to increase stair use. So, you know, some people say, oh, what can a little bit of stair use do for me? Well, caloric burn calculations suggest that, you know, if the average American adult was to climb just 2 minutes of stairs per day, we would basically eliminate, we could eliminate the average weight gains that U.S. adults see annually. There's also a study of over 10,000 Harvard alumni men, and they found that the men who climbed 20 to 34 floors of stairs per week, so divide that by 7, that's only 3 to 5 floors a day, they had a nearly 30% reduction in the risk of stroke, and that was independent of whether they exercised in their leisure time. So there are now a whole host of interventions that can be used to increase stair use. Very simple and inexpensive intervention is merely to place point of decision reminders at elevator call areas and outside of stairwells to remind people to take the stairs for health and other benefits. Designing stairs so that they have music and art and are wonderful and comfortable environments important. If they can be seen when you walk through the entrance and they're accessible, they're more highly likely to be used. And, you know, in very high-rise buildings, you know, people may not want to or may not be able to walk 30 stories up to their floor. However, you can actually program many elevators to not stop at every floor, so that you can stop at every 3rd or 4th floor and accept your one elevator to serve people with disabilities. And there have been studies shown in buildings that use those skip-stop elevators and show a 3,300% increase in stair use. The other piece, of course, is addressing the healthy versus unhealthy food and beverage access issues. So thinking about food retail, are there retail premises for healthy food like supermarkets, farmers markets, shops that sell fresh fruits and vegetables? And that's in comparison to the density and the amounts of fast food restaurants that you have, which have been shown to be associated with increased weight and obesity in area residents in some studies. Community gardening, although community gardens may not produce enough fruits and vegetables to necessarily provide enough fruits and vegetables for everyone in the community, exposure to community gardening in adults and children. There are some studies showing that people who are exposed to community gardening may eat more fruits and vegetables, including children. The other piece of it is to think about beverages. So access to tap water versus caloric beverages. So do your your streets, your parks, do they have availability of tap water through water fountains that people can drink? Or must they run into a store and buy either a bottled water or a highly caloric beverage in order to drink? Do your worksite buildings have sufficient access to tap water facilities? And caloric beverages, of course, are a high source of calories. At least in the United States, a large percentage of calories during the day are consumed in the form of beverages. And consuming calories in the form of beverages is actually really bad for you because it actually does not lead to you feeling full. You can drink 1,000 calories worth of calories, and unlike eating 1,000 calories worth of food, you actually don't feel full because the whole process of chewing your food and eating your food actually helps with the satiation process. Now, in addition to the health benefits, there are a whole host of benefits outside of health as well. Co-benefits for the environment. So if you're walking or taking bicycling or taking transit, not only you're addressing the physical activity equation, but you're actually also addressing fuel use and air quality. Stairs rather than elevators and escalators. Well, elevators and escalators operate by using electricity. And in fact, something like escalators apparently break down all the time. So they actually have also really high maintenance costs for buildings that have them. Active recreation rather than television. You know, in New York State, televisions are very soon projected to overtake refrigerators as the main source of household appliance energy use. And so, you know, if we can decrease television viewing by increasing people's recreation time, doing active things, going outdoors, you can actually assist with these electricity concerns as well. Additionally, in the summertime, if you're sitting in your house watching television, usually your air conditioning is also turned full blast. And so trying to get people out of their houses and playing actively during their recreation times can also assist. And on the food and beverage side, I mean, we've often heard about the environmental issues related to bottled water, but if you think about our highly caloric beverages, what do they come in? They come in bottles and cans. And so they have all of the transportation miles that we talk about for bottled water. In fact, they may have more because not only do they have the water component, they also have all of those other ingredients that have to be shipped and processed again and then reshipped again in order to be bottled. On top of it, of course, all of these cans and bottles, like the water bottles of bottled water, go into our landfill. And finally, fresh produce rather than unhealthy processed foods. If you look at processed foods, many of them come very highly packaged. And of course, you know, the transportation miles related to the processing of those foods are also major issues. Additionally, you know, when we think about the designs of our buildings and neighborhoods, universal accessibility for people who are aging, who have disabilities are a key issue, and we want places that are accessible. Well, creating a very walkable, mixed-use realm actually serves universal accessibility really well. If you have good sidewalks, if you have good crossings that are safe, good lighting at night, these are all things that really help an aging population to be able to continue to function in their communities, people with disabilities to be able to use their streets and their neighborhoods. And even in the buildings, our Mayor's Office of People with Disabilities, who worked with us on the Active Design Guidelines, pointed out to us that increasing stair use amongst people who are able-bodied actually frees up elevators for people who need them. A very crowded elevator is not very functional for people who have to be in wheelchairs, as an example. There are also economic benefits. So this study shows the costs of building sprawled infrastructure compared to a more compact infrastructure in communities. So there are savings to be had not only in the building of this infrastructure, but in actually maintaining this infrastructure over time. Households can also save money, and so this is a very important social equity issue. People who live in walkable, transit-rich neighborhoods typically spend, this is in the United States, about 9% of their monthly incomes on transportation costs, compared to 25% of their monthly incomes in completely auto-dependent neighborhoods. Job creation is another potential economic benefit. So when you create, for example, supermarkets in high-needs neighborhoods, you're actually creating a place where employment also occurs. When you create road infrastructure that actually has bicycle and pedestrian infrastructure on it, as well as only car infrastructure, you actually create more jobs per $1 million spent on that road infrastructure, because you save on the land costs, but you're increasing the intensivity of the labor needed to create those roads. So there are many things that can benefit from this. If we're going to do this, however, we need to start to integrate health into urban and building planning policies and practices. And if we're going to do that, how do we do it? Well, certainly those of us in health, we can bring all of these issues to the fore, but we don't design and build and create and construct our environments. And so we very much rely on our partners in architecture, in urban planning, in urban design, and landscape architecture, and the developers who develop some of our land and our real estate to be partners to us in doing this. There are many synergies and co-benefits beyond health, as I've mentioned, that give us all reasons to work together. There are complementary roles. Many of our great, wonderful ideas around these issues have come from the co-leadership in New York and elsewhere from our other departments, from private sector architects and developers themselves, because you know this world, those of you who work in this world, and you know where feasible ideas are, where the opportunities are, both on the policy and practice front. And health can work with you to integrate the evidence into these opportunities that you identify. Researchers have been a key partner to us in helping us review the literature, the scientific literature, and synthesizing it so that our initiatives are evidence-based. They also play a key role for us in helping us to evaluate innovative initiatives. They can get grants to do those evaluations and those research. And one of the other things as well in New York is we've had these annual Fit City conferences. These are conferences that really bring together the different sectors, public and private, health, non-health, from government and from the private sector, to really have a dialogue every year about what we can do in the city and what we've done in the past year in the city. So for those of you who might be coming to New York City or are interested in coming, we have our next Fit City, the 8th annual conference, June 24th and 25th in New York City. It's usually held at the Center for Architecture, and we would welcome your participation. Fit City conferences, as I talked about, we're now at our 8th one in the upcoming year. Another initiative that actually came out of a brainstormed idea in Fit City 2 are the active design guidelines. The active design guidelines are a set of guidelines outlining evidence-based and best practice strategies for creating healthy urban designs and healthy building designs to integrate activity into daily life, as well as healthy eating and healthy beverage opportunities. And you could see here the team that created the active design guidelines. It was a co-leadership model across sectors, 4 key departments in the city: health, design and construction, which is the equivalent of our public works, transportation and city planning, all co-led this. By the time we finished the guidelines, it actually had a total of 12 city agencies giving inputs and writing sections for it, including housing, school construction, parks, Department of Buildings, Department for the Aging. And then we also actually, once we drafted the guidelines, we actually had a design workshop where we invited major architectural firms and urban design firms and developer firms, the private sector, to come and join us to give inputs into the guidelines. And after we got all those inputs, we actually revised and edited the guidelines before publishing it finally in 2010. These are an example of the types of strategies for the urban design chapter. Certainly land use mix is a fundamental key part of being able to walk to nearby destinations, including school sites near to where people live. As part of the land use mix, access to healthy food premises like supermarkets, farmers markets, drinking water in the public realm, Also recreational areas like parks, play areas, pedestrian plazas. Transit access is key in New York City, where we have areas underserved by the subway. We have been actively increasing transit access through the use of bus rapid transit, which can be ramped up quickly and much more inexpensively than actually digging into the ground to create rail. It's been very successful in increasing transit, even in a place like New York where transit was already high, increasing the pedestrian friendliness of the environment. So we're not talking about merely having sidewalks, but actually having a very inviting urban realm for people to walk in. I'll talk about some of that. Bicycle network and infrastructure. And then complementary strategies in the building side. Bicycle parking and storage, a very critical complement to bicycling infrastructure on our streets. Active recreation spaces for children and adults, both in our work sites and in our homes, particularly multi-residential buildings for housing. We've talked about stairs and the various things that can be done. The elevator design, including skip-stop elevators, access to drinking water within worksite buildings as well. So I'm going to go through now and talk a little bit about some of the policies that New York City has undertaken to integrate health into architecture, planning, design, and the non-health areas. So one of the key guidance documents to New York City's work is Plan YC. Plan YC is our sustainability planning document and our document for guiding the expected population growth in New York City. New York City has a population currently of about 8 million. We're anticipated to grow to about 9 million by 2030. So of course with that comes all of the inherent issues about infrastructure, sufficient housing, sufficient affordable housing, sufficient space and infrastructure for transportation, addressing issues like traffic congestion, quality of life issues like having access to open spaces, to parks, to green space, water quality, but also active access to the water for more recreation and active recreation. And I wanted to mention that Plan YC, the version that was just released in 2011 actually has a public health chapter that's inserted into that work. Public health as a theme that is integrated throughout the master planning process. The general approach as well in New York City is to plan using a smart growth model. So transit-oriented development is a very key piece, and planning, of course, for modes outside of the automobile is a very key part of planning for continued quality of life for the environment as well as for traffic congestion issues. A very key part in New York City, for those of you who may have visited in more recent years, is you've seen the form of the public right-of-way change. Complete streets are what we are creating to accommodate all user modes. You can see from this slide there's lanes for the bicycle. We are trying to create more and more protected bike lanes. Where we can't necessarily do that, you could see that the way that we've painted our bicycle lanes merely with paint and where we orient the bicycle lane, i.e. between the parked car and the sidewalk, actually utilizes that parked car with a little bit of painted buffer. So there's no additional infrastructure costs required to actually create protected bicycle lanes using your parked car. You could see there the bus-only lane that serves our bus rapid transit expansions. We have a public plaza program to create more open space in areas that lack parks and open spaces. This is an example of a public plaza. You can take areas otherwise only dedicated to the car and pedestrianize them very inexpensively, really, with paint and plant potters and a little bit of street furniture in order to create a more pedestrian realm. This is Times Square. So we're doing it in small places like you've seen on the slide, and we're doing it in large places like Times Square. Times Square, severe problems with traffic congestion previously. 89, and of course with also very, very crowded sidewalks. Even though there are many, many pedestrians at Times Square, 89% of the road space was previously dedicated to vehicles, very small percentage to people. And this is what we've done. We have created a pedestrian plaza at Times Square, and traffic has not come to a halt. In fact, with proper planning, traffic flows are actually better And you could see here we're evaluating, and at places like Times Square and Herald Square that already had very large pedestrian volumes continue to go up. But on top of that, there's economic benefits. So studies by our Department of Transportation show that retail is up in Times Square. So when people are on foot and can just walk into that retail environment, they are doing so. But, you know, in very congested areas for the car, they are not going to park their car, get out, and go to those retail areas. On top of it, the Union Square area, where we've also improved the pedestrian environment, we show 49% drops in vacant storefronts compared to other areas where this hasn't been done. Another example of what's been done in zoning is using zoning to actually impact the typology and continuity of the pedestrian sidewalk. So in this case, you could see that without the preservation text amendment for residential streetscapes, one of the things that our city planning department found was that the sidewalks were very frequently interrupted by curb cuts, really meant for cars. And so by actually just tweaking the text of related to the zoning measure, they were able to cluster the driveways for cars to actually improve the continuity of the sidewalk. Car share, again, city planning has undertaken zoning amendments that allow for car share to locate in the city. So if you're going to have something like car share, vehicles that people join a membership to these companies and they don't need to then own their own car, or some of them will sell off their own car if they don't need it very much, and they can rent these cars as needed on an hourly basis to, for example, if they have to go to an area, to go out to the beach for a few hours, to, you know, do a big grocery shopping excursion. Basically, that zoning has played a really key role in shaping how to locate these cars and how to park these cars in the city. You can see from this slide that car share vehicles actually eliminate the number of private vehicles on the road. Bicycle networks, a key part of it. Very important to think about the continuity of these networks so they don't just stop short all of a sudden. And then complementing that, of course, is parking infrastructure. In New York City, we have a zoning law now that requires bicycle parking in our new buildings, both residential and commercial buildings. And that is actually, the requirement is paired with an allowance for a floor area discount. So in other words, the area that is required for bicycle parking does not count against the developer into area that is important for rentable space. Because that is discounted in the required parking area. Bike share, which you have here, it's coming to New York City this year, and then when it opens and starts, it will be the largest bicycle share in the United States with 10,000 bicycles and 600 stations. Health is playing a critical role with transportation in the health evaluation related to bike share. We've talked about healthy food as part of this mix. Health has been working with city planning and economic development on these issues, and as part of that, we've been able to create a series of zoning and tax incentives for supermarket operators to locate supermarkets in our food desert neighborhoods. Parks and open spaces, again, another important piece. You know, the High Line, for those of you who've been there, it is an old abandoned railway that was taken by the city and converted into basically a walking park, a walking elevated park. Now people from all over the world come. It is a major tourist attraction. It has grown both retail and real estate development around the site. And the city has actually gained, in terms of revenue from real estate and retail taxation, amongst other sources of income that have come in from this area. It has gained back its investments many, many fold, I've been told. Again, this is from the High Line itself. And also we're developing our waterfront, and we're developing it for access to recreation as well as a greenway for active transportation. We are also programming our streets to allow them to be closed regularly for active play. So Summer Streets is a street closure that has occurred since 2008, 7-mile strip of Park Avenue from Brooklyn Bridge connecting into Central Park at 72nd Street. And in Central Park, you have the 6-mile loop that allows people to come out on Saturdays in August to walk, bicycle, rollerblade, etc. And along the way, there's active recreation stations, and people love it. Now, one of the things that we found, so this is the evaluation that Health did with transportation, and you can see that actually the people who came out were meeting basically approximately half of their weekly recommendations by coming out to the Summer Streets Day. About nearly 90% of them came out by active modes, and we had people who said, you know, they hadn't biked in like since they were a child, and for the first time they were bicycling because of Summer Streets. One of the things we did find was that some of our outer boroughs, because this occurred in Manhattan, folks were not necessarily coming out, and some of the high needs areas in these outer boroughs, they were underrepresented. And so one of the things we did was we worked with transportation to look for ways to close streets in even our outer boroughs. So now we have a program called Play Streets, which are single blocks of streets that can be closed to cars, and community groups can run these play streets with a permit from DOT, and so can schools that don't have enough play space, and you can close these quieter blocks of streets to cars and allow children and families to come out and play, and they occur, you know, daily through the summer or weekly or on certain days. And you could see that, you know, children are coming out for a significant amount of time, and the most likely activity that parents report if the children don't come out to the play street is being inside, probably watching television. And then, of course, we're undertaking all sorts of measures, both in terms of building design as well as stair prompt signage to promote stair use. We are improving access to tap water in our public realm and in our buildings as part of our green codes process to green our construction codes. We actually passed a parameter in our plumbing codes that increases and improves tap water access in our worksite buildings. So now all buildings have to have not only sort of water fountain facilities, but also tap water, water bottle refilling stations for staff. Now, we've talked about a lot of measures like zoning processes, which can require a legislative process or a city council process, but there are also many things that we were able to do through city administrative processes across sectors. So, for example, many of our agencies, like our design and construction agency, the equivalent to Public Works, our school construction authority, our economic development sector, have put into place requests for proposals and contractual language that integrates the active design guidelines and its elements into them. The guidelines and standards for design and construction in our various agencies now reference the active design guidelines and have integrated relevant elements directly into them. Active design issues and checklists can be included in development review processes and approvals. And we've also actually, Health actually got a grant, and we have been also training city staff in all these agencies, all our different agencies on the active design guidelines and integration into their work. Now, I want to finish up with the last few slides. You could see here the investments that the U.S. Centers for Disease Control and Prevention in the United States has undertaken in creating healthier environments. So in the last 2-3 years, they funded all 50 states and over 50 communities to actually undertake work to create healthier policies and healthier environments in order to address tobacco and obesity. About 40 of those 50 communities or local jurisdictions are working on obesity issues, about 10 on tobacco issues. Of the 40 communities working on obesity issues, about 30 of them are specifically addressing the built environment. And New York City was given actually a separate grant to help to mentor about half of those 30 communities. So 14 of the 30 communities, and you could see that they're from coast to coast and have varying typologies. Many of them have both urban and suburban areas, some also more rural areas. And this is the type of partnerships that you're seeing across U.S. communities. Health, working with planning, with transportation, with school construction and education, with parks and recreation, with public works, with housing, and with the Department of Buildings on relevant code issues. And these are the types of impacts that we've seen. In New York City, we have increased commuter cycling, approximately 300%. Bus and subway ridership, despite already high ridership in the past, has gone up further. And as I mentioned, we have been rapidly expanding bus rapid transit in areas without or underserved by the subway. We've increased the places for children's play, including the play streets that I've spoken about, but also we've been converting schoolyards to community playgrounds that are open at after school hours and on weekends. We've increased stair use wherever we put those stair prompts. We're working with architects to design better buildings for stair use. At the same time, we've decreased traffic fatalities, we've decreased traffic volumes, and we've decreased car registrations. And we're very happy to report that for the first time we've seen a reversal in childhood obesity. A couple of our mentee communities, Philadelphia and San Diego, also recently reported that they've seen reversals in childhood obesity. Now, this is a problem that's been growing rapidly for the last 2 to 3 decades, and the fact that we've been doing this work over just the last few years and have been able to already see an impact, we're extremely happy and pleased with. So thank you very much, and I believe we're going to take some questions.
First of all, Karen, people are saying thank you for your fantastic presentation. And they're particularly interested in saying there's been some great impacts and outcomes, but what have been the key enablers to make these happen? What made decision makers, planners want to make the changes to undertake these changes?
I think that one of the key things has been that, all of those synergistic outcomes that I identified for environmental sustainability, for universal accessibility, for economic development and revitalization, many of these things actually, we'd actually never really thought about in health very much, right? But as we started talking to our planners and to our architects and to our developers and to our other city agencies, these were things that these other sectors actually pointed out to us that, hey, we want to do this because there's all these other outcomes that can be impacted at the same time. Another thing that was voiced to us is that, the health argument, the fact that those who are trying to advance environmental sustainability issues or economic development issues, if they actually had health as another outcome that they can cite a benefit of, that was actually extremely helpful because members of the public actually care a lot about their health and the health of their children. And so those were some of the reasons that have prompted a lot of collaborations.
One of the questions that has just come in is asking about vulnerable groups and whether your evaluations have actually looked at some of those vulnerable groups, whether they be children, people with disabilities, pedestrians, etc., specifically those more vulnerable road users.
So were the evaluations, do they relate to them? Yes. Well, as I said, when we undertook evaluations of, for example, summer streets, we very specifically asked people about their home zip codes because we wanted to capture, people who are coming out, where were they living, as an example. And we were able to identify that more vulnerable groups, like groups who suffered from health disparities living out in some of the outer borough neighborhoods, were underrepresented. And so capturing that both in terms of the evaluations, but then using those evaluations to come back to policy issues that we could undertake to address that. So we went back to transportation to say, hey, these vulnerable groups, like those suffering most from health disparities, may not be coming out to summer streets. So is there a possibility of us actually doing some of these street closures in some of our outer boroughs, and particularly in some of our highest needs neighborhoods? So we grappled with that because a couple of things. One is, for something like summer streets, one of the major costs of summer streets is actually the closing of intersections. So when you actually have a fairly distant route, which is excellent because you want that distance for adults to be able to cycle and run distances. So where you can do it, it's fantastic. But expanding that, into the outer boroughs and the distance that would require would have cost too much money. And of course, the economic situation in New York in recent years has made it difficult to do that. So DOT actually proposed a very creative solution, which was closing single blocks of streets that didn't cross intersections. And those would actually, those were indeed feasible in their mindsets. And so we started to work with them on creating a systematic permitting process for that. And they then came back to health to say, hey, if you're going to do that, make sure there's a staff person who can actually provide technical assistance to the community groups and schools which might become interested in doing that. And initially we said, oh, well, do you need a staff person? Because perhaps we could get a grant and give you that staff person. And they said, well, we don't need that staff person, but we need you to have that staff person so that you can work with these groups. But we'll do the permitting and we'll create this group of permits to allow this to happen. And so very important, I think, not just to think of it in terms of the evaluations need to capture outcomes for potential vulnerable groups. But then I think you need to use those outcomes to actually then impact policy where there might be inadequacies to ensure that more vulnerable groups are, their needs are also addressed.
In relation to the street closures, is there anything in place that ensures that there's no street vendors selling high-density energy drinks or junk food at the same time? So are you thinking about both getting people out and enjoying physical activity, but also thinking about the nutrition side as well, so not countering the balance?
On the summer streets and the play streets, their main focus is active recreation. So in fact, unlike the sort of the street parties that we've had for many years in New York City, where the focus has been on selling wares like goods like clothing or different types of trinkets and stuff, and where you also have a lot of unhealthy food vendors, the focus, so on the summer streets route, there is no there is no sort of selling of these wares. There is no selling of food. There is, however, like we do set up, we have something called Water on the Go, which our Department of Environmental Protection puts out, and these are actually water fountains that can be hooked up to water hydrants. And so these water fountains are set up along the route to allow for that. One of the things that I didn't have time to mention as well, one of our initiatives as well is in our food desert areas, so in addition to working to create new supermarkets as well as more farmers markets, we also have a Green Carts program. And the Green Carts program is actually street food carts that sell only fresh fruits and vegetables. And one of the things that we noticed was that our street food vending process actually has a very, very long waiting list to get the street food permits, street food cart permits. And so we actually created a new class of street food permits that people could get if they were willing to sell fruits and vegetables in the food desert areas. And so a whole host of the people on that waiting list decided to jump the list, to jump over to the other queue to take advantage of this new set of permits. So yes, we're trying to address it from both sides.
Just a few more minutes before we finish, and if people would like to log their questions. Just a question around private organisations. You talked about developers there and food vendors. Has it been difficult to get private organisations to engage with this in terms of responding to the new codes or practices?
Well, I think, we've had different sorts of initiatives to engage the private sector. So there's certainly, for example, completely voluntary initiatives, particularly early on when we began, when we created the the stair prompt signage that says burn calories, not electricity. The health department could have just developed those signage by ourselves, for example, but we didn't. We actually engaged the Real Estate Board of New York, the American Institute of Architects, to co-create those signs with us and to actually help us to distribute those signs to their constituencies. And so because they were engaged from the very start and had inputs into actually what those signs looked like, et cetera, they've been great partners to us in those parameters. The other thing as well is, I talked a lot about incentives as a part of our policy, so zoning incentives, tax incentives, and those are things actually that developers in the private sector frequently call for. And so they've been very supportive of the incentives that we've created. We also have some very innovative folks, as there are in every sector, including the private sector, who have been, early adopters of this. And when they become an early adopter and they show that it can work, they've been great spokespeople because they can speak to the feasibility. They can actually speak to reasons that we haven't even spoken of as to why they got on board, when they did and why they did it. So I'll give you an example. We have an affordable housing developer who's been working with us on a number of projects now. And one of the questions that that has been asked of him when he's presented, for example, he presented at one of our fit cities, one of the questions asked for him was like, why would you do this as a developer? And he's a developer of affordable housing. And what was really interesting, of course, was he said, well, as a developer of affordable housing, of course I want as many good outcomes and socially beneficial outcomes for my tenants as possible, but of course I still have to think about my bottom line, the profits, etc. He then went on to highlight the numbers of things you could do from the active design guidelines that cost no money at all. So for example, whether you place the stair in front of your building or tucked in some corner, you have to place that fire stair, right? And whether you paint it a gray color or you paint it with bright colors and improve the aesthetic elements, that costs no money. And yet, when you actually do some of those things, they have outcomes for your tenants. That is actually very good for actually selling your development to the community boards that have to approve this. On top of it, though, if you're a market rate developer, you can actually start to market potentially health benefits. If you're an affordable housing developer, this developer actually said, if I have a healthy population living in my buildings, I actually have to worry less about rent stability because, high needs populations who are working that minimum wage job without benefits, in many cases in the United States, there's no health benefits to some of those minimum wage jobs. If they get sick, they are not getting paid for those sick days. And then they fall behind in rent, et cetera, et cetera. They can't go to work because their children's sick. And so there's actually all of these outcomes that, like I said, in health, we didn't necessarily know about those outcomes, but as you start to work with some of the early adopters, they will highlight to you the benefits that are beyond what you've even expected.